And tell me, can you see this MRI scan?
I can.
Great. So this is an MRI of the brain. It's something called a flare signal that shows inflammation. And let me just orient you a little bit.
Okay.
So you're laying in the scanner and your feet are coming out towards me. And so this is the right side of your head and this is the left side.
Okay.
This is the right eye, the left eye. These beautiful intricate things are the turbinate cartilages of the nose. This is your cerebellum, and these are the tips of your temporal lobes. So we're going to kind of climb up, and just to give you an idea, it starts way at the bottom here. The sinuses. This is the brainstem. We're going to move up slowly. So we're moving, kind of looking at slices of you. Cerebellum here. Moving up, now we're seeing the temporal lobes and the top of the cerebellum. This is the midbrain, the pons. But let's get into the business. So the areas that control memory, thinking, verbal, visual, spatial memory, these are in the temporal lobes, and you can see those are completely normal. Given your art history, I would bet they're kind of super normal. Frontal lobes, judgment.
Now, when you say super normal, that's because of what now?
That's because I think you're a very good artist, Terrence.
Oh, thank you.
These are areas, the frontal lobe, judgment, rationality, those are completely normal. But as we get higher up, you start to see this white matter abnormality here. And it's primarily on this left side. And it starts in an area that's closer to where the leg is involved. And that's probably where your difficulties began. And then it moves up into these areas where the hand and arm are controlled. And again, the gray matter out here, kind of the gyri and sulci, the areas that originate the thinking for moving your arms and your leg, your arm and your leg on the right side of your body, that's normal. But the cabling, the white matter, the wires that connect that ability to think about moving your arm and leg and knowing where they are in space and all of that, those are intact, but they can't get that signal past these scars in the white matter to get it out to the spinal cord and to the rest of your body. And so if we go further up, because of the damage to the white matter, you see that there's atrophy in this area of the cortex. See how normal and plump these gyri and sulci are here, but they're really thin and kind of atrophic over here. And that's because they're not being exercised because they're not hitting their target and communicating back and forth with the limbs.